Thank you, Jess. And I do just have to say that working with Jess, the Maine Council on Aging, has been one of the greatest initiatives that I've worked on in my short 6 years at the State House. It has been fulfilling. I have a lot of energy moving into the next legislative session over the next 2 years to make sure that we address this policy imperative. So a big thank you to the Maine Council on Aging for all the initiative and the effort that they've put into this as well. And with that, we'll take some questions.
Mr. Speaker, can you elaborate a little bit on the finances of all this? You're talking a $65 million bond issue, which I presume would build 1,000 homes like this.
That's right.
And then if you can also talk about how much of a larger rebate or tax break on property tax you want, and how much of a pay raise for the home care workers.
So the $65 million housing bond, we are looking to build or rehab old historic buildings and mills for 1,000 households in 40 sites all across the state in every county. So that is, as was outlined, a well-identified need. As it relates for the property tax relief credit, we were able to more than double that over this last legislative session, which I'm very proud to have helped lead with a broad bipartisan coalition to make sure that that happened. And we are going to work very hard to increase that credit. We are going to try to get back to where we were a couple of years ago before the proposal to nearly eliminate the circuit breaker program, but it's going to be something that we're highly focused on because of the stories that we've heard. When I knock on doors and you talk to seniors, it's heartbreaking when you see it in their eyes and you know that they're not elaborating, they're not making things up. They are very scared that they're going to have to move out of their homes. So we have to do more to make sure that the property tax relief credit is increased. And as it relates to direct care workers, you know, as was outlined, these folks do incredible work for our seniors to make sure that they can live independently in their homes and have a more secure retirement. We are in the initial stages. We will be defining what that rate is. We are 4 months out from the legislative session beginning, but we are going to be working with the coalition, with a bipartisan group of individuals to do what makes sense for Maine and for direct care workforce, so that they can stay, so that Mainers can stay in their home as long as they can.
You don't know at this point how much of an increase, how much that would cost, because you know you're also facing a need to pay nursing homes more.
So what we're doing right now is demonstrating the need, putting a spotlight on what we know Maine seniors already know and what they're telling us, and that is to make this a policy priority, to make sure that it is a priority going into the next legislative session. And what I've found over the last, again, short 6 years that I've been in the legislature is when you demonstrate a need and you make it a priority, leaders tend to understand that, and it happens. So we are not at a defined dollar amount. We are looking at what that might be that makes sense to make sure that we have a well-trained workforce to keep seniors in their homes so that they can have a secure retirement.
Mark, what's the current situation as far as direct care workers is concerned for salaries? Do they tend to be paid minimum wage? Do they tend to be paid what the market will bear? Are they represented, or any of them represented by collective bargaining units? How does that work exactly?
So generally the number that has been most used, and there is a bit of a range, but it's around $9 an hour. So just above minimum wage, but not enough, not a livable wage, and certainly not reflective of the type of work that they are doing for our seniors. So this is a group of hard-working Mainers that need financial support to continue to do what they're doing. And as Jess said, we need to expand that workforce because of our changing demographics.
So would a collective bargaining unit be one way at establishing a statewide range of salaries?
Yeah, we're not looking at that at this point. We're looking at what makes sense in terms of the rate meeting the need to make sure that seniors can stay connected in their communities, age with dignity in the homes that they've raised a generation with. So that level of detail will be coming out. It'll be a product of the work that we're doing, again, with the bipartisan coalition and the work groups that are established.
So are you talking about what they're paid? They're allowed to be paid now by Medicaid. Is that what the issue is?
So it's the Medicaid rate that's established now, and the money that is paid directly to the direct care workforce. So there's a rate that gets paid to agencies, and then they pay their workers to do that.
So what you'd be looking to do is increase the rate that Medicaid is allowed to pay for?
That's right.
Does that worker shortage, does that tend to be more acute in northern and eastern Maine as opposed to southern Maine, or is it fairly spread out evenly across the state?
Yeah, I think it's universal in terms of the need. There might be pockets that are in more need as it relates to the workforce, but it is one that's been demonstrated throughout the entire state. We need to put a focus on it to make sure that Mainers can, again, age in their homes where they want to.
Hi, my name is Steve, and I'm with Spectrum Generations, and I'm actually a volunteer and with Meals on Wheels, and I'm actually delivering them as we speak. And I've been retired for a couple of years. I was a healthcare administrator for 40 years, and I agree exactly with what you're talking about regarding staff. It's the most important part other than the residents and the patients. I'm wondering if there's any idea of increasing the rate that or subsidies for Spectrum Generations and other organizations, food kitchens, etc., because they've been cut pretty severely in the last few years, and it's hard to raise that kind of money to feed our elderly who can't get out and do it for themselves.
Yeah. So that is the value of having these 5 expert work groups established, working on not just community-based initiatives, but also providing ideas for legislative-based initiatives. So with one of those groups, we can take that and look at that and see what can be done. And really, again, it's a matter of reprioritizing current spending and making sure that this happens for Maine seniors.
Okay, one more question.
There's one over here. Included in all of this, seniors need transportation due to health problems, and it's very good with all this to keep them in their homes and in communities, but transportation is a huge issue. I came here with a car. I cannot drive anymore because of my eyes. And you have to include that because we can't get around, even ones that are able to get around.
So I don't know if you heard the question, but the issue of transportation, housing and transportation have been the 2 most frequently repeated needs that people have identified. That is part of what we are talking about in these working groups, so that is going to be part of what we're focused on and why we think it makes a whole lot of sense to locate housing in areas that are connected to the community, that are easily accessible, that have the transportation networks so that you can get to the grocery store and the doctor's office. So that will be part of the focus of making sure that wherever we develop, it's in a way that makes sense, that emphasizes aging-friendly communities, and makes sure that not only do we have the housing, but we have the social inclusion for our seniors, and that is intergenerational and opportunities for everybody to connect with one another in the community.
I have a question. I live here in Creekside. I'm a registered nurse, and I've been unemployed for the last 6 years. My question is, do you have a timeline on when we can expect results from all your activities?
That's a great question, results. So this upcoming January is when the legislative session starts. These 3 bills will be, I will introduce these bills. The legislative session goes from January typically to mid-June or July, so that's the time frame that we're working in, that these will be accomplished within the next legislative session.
Any other questions from the press?
Have you had any discussions with Representative Fredette or any of the Republican leadership about this, and do they seem lukewarm to it at all? Or?
So one of the great things, one of the things I really appreciate about this initiative is that there is bipartisan buy-in. You know, whether it's those that attended the Aging Summit in January or participated in the speakers' roundtables last fall, there is a lot of interest in making sure that we address this policy imperative and do right by Maine seniors. So I think you will find through establishing this bipartisan aging caucus that it will be well represented by both sides of the aisle in both the House and the Senate, and that is the intention.
And you spoke about reallocating resources to deal to this problem. Are you talking about shifting resources within Department of Health and Human Services, taking money from other parts of the state budget to put into this? What sort of things are you talking about?
So we are going to do, as we do every 2 years, a comprehensive look at current state spending and see if that's done in the most efficient way in targeting the priorities that we want. What today is about and what the last year is about has been talking about how can we raise the profile of this issue in a way that catches policy makers' attention and motivates them to move. And I think we're there with the conversations that we've had, and I'm really excited about reprioritizing some of those resources to make sure that we are supporting our direct care workforce, that support seniors in their homes, that we are able to do more around affordable senior housing and increase the property tax relief credit.